Today we're going to walk through priming a line for a PCA and then assembling with the PCA pump. So what we're going to do first is you'll get your PCA tubing, and you're going to get this from the medication room. And then what you're going to do is you're going to get your syringe with the PCA medication from the Omnicell. And when you're priming the line, you're going to connect your syringe to the top portion here where the purple knob is. And then you're going to use a normal saline flush, and you're going to connect that to this part right here. And this is going to be where your maintenance fluids connect to. So what you want to do for priming the line is you're first going to prime with the medication. And you're going to prime it all the way till the end and make sure that all of it gets to the bottom that's going to be connected to the patient. And then after you prime it with the medication, you're going to prime this portion with a normal saline flush. And once that portion is flushed through and primed, you'll take this off and you'll connect it to your maintenance fluids, which will bring us over to the PCA pump. So right now we have our maintenance fluids already hanging. We have normal saline for our maintenance fluids, which will be specified in the MAR. You'll take this off and then you'll connect it right here. And then you'll have your portion for the medication. So what you're gonna do for the medication is you're gonna connect this area right here under the gray knobs. And then you're gonna take your plunger gripper and you're gonna connect it around the top of the syringe. After that's completed, you're gonna take your barrel clamp and you're gonna put that in front. Now, a really important tip is to make sure that you have the name of your medication and the barcode facing the front, because when you have to document on the administration times and things like that, it's gonna be a lot easier for you to scan that barcode. So what you're gonna do next is you're gonna close this portion and you'll have your PCA key. You're gonna take your key and you're gonna turn it from the unlock to program. So what you're gonna do is make sure that you turn your pump on. And then just as a fact, if any of these things are not in the correct place, the PCA will alarm. And that's the first thing you should do to troubleshoot, is make sure that your plunger is over the top of the syringe and your barrel clamp is in place. Otherwise it won't let you program it or lock it. So you're gonna do new patient, OB. And then what you're gonna do is go channel select, confirm. This is gonna be your only option, so you'll click that, confirm. We have hydromorphone, so we'll use that as our medication. Yes, confirm. Confirm the drug amount with your PCA pump. Then you're gonna click next. Now this is a high-risk medication, so when we do scan it in the MAR, it's gonna be dual verified by another nurse, and you'll wanna go through this with another nurse. We do not have a continuous dose. If you had a continuous dose plus a PCA dose, you would choose this one. If you had only a continuous, you would choose here. But for today, we're only doing a PCA dose, so we're gonna click that option. Our PCA dose is gonna be 0.2 milligrams, and we're gonna be able to give that every 10 minutes. We're gonna confirm this with our MAR, dual verify it, and then you can press confirm here. Now it's gonna give you the instructions to lock it. So you'll turn your key to the locked interval, and then you'll be able to press start. Make sure that when your PCA is running, we also have our maintenance fluids set to normal saline at a rate of usually 25, but confirm with your MAR. Now, when both of these things are running, the next thing it's gonna have you do is set up EtCO2 tubing. And this is to make sure that your patient's respiratory rate and quality are correct while being on this high dose medication. How you utilize this is it comes in a packaging. You have the option of hooking it up to oxygen. Not all patients require oxygen though. So it's not necessary to start with it connected to oxygen. The yellow end here is gonna connect to the EtCO2 monitor. You're gonna twist this, and then you are gonna tighten this into place so it'll remain like so. And then you'll place the tubing, just like you would a nasal cannula, over your patient's face. And then as they breathe, they'll have a waveform. So if I were to practice it on myself, just so you guys can kind of see. You would put it into place, press channel select, and as your patient starts to breathe, you'll be able to see a waveform. Now, if the respiratory rate is lower than the set amount, then it will alarm, and you'll be able to document on how many times it alarmed to see if there's any adjustment needed for the alarm settings or for the PCA dose medication.